All right, guys, my name is Asha Creary, and I am a licensed professional counselor in the state of Texas and a licensed professional counselor approved supervisor in the state of Missouri. In this episode with Post-Grad with Asha, NCE edition, we will dive into talking about Section 5 of the NCE or talk about Domain 5 of the NCE. We will not necessarily go into questions this particular video. That will be in our follow-up video. So the fifth domain covers counseling skills and interventions. It is 30% of your test. This is the largest section of the NCE. It has 48 scored items, and this section encompasses a counselor's knowledge, skills, and abilities to conduct effective counseling. So as I mentioned, I think maybe in the last video or the video before that, the NCE is not a knowledge-based exam. The NCE is, do you know the information and do you know how to apply the information, and can you deduct what you are assessing in the question or what information you need to pull out of the question. So this question will test you over, it's A through W, was that 23 subsections. So we'll just jump right into it. So subsection A says align intervention with the client's developmental level. So if working with children, the developmental level may require play therapy, video game therapy, or sand trade. It also may require appropriate implementation of tools and techniques based on their language, right? So even if you're working with an adult, if they have an intellectual disability, you may still choose counseling skills or techniques that most align with working with children, such again as play therapy, art-based therapy, expressive arts therapy, the things. So just making sure that you understand where your client is and how to best support them in their journey. The next subsection, which is subsection B, is to align the intervention with the counseling modality, individual, couple, family, or group. So this ensures that the clinician is using the appropriate modality. So when working with couples, you wouldn't use individual counseling. And when you're doing individual counseling, you wouldn't use Gottman per se. You may pull from them and do integrative therapy, but you wouldn't use that as your sole modality of working with an individual unless they're dealing with like relationship issues. And you need to pull from it. So just assessing and identifying what the correct modality would be. When working with a couple, you may not necessarily use EMDR. When working with families, you may not necessarily use Gottman, right? Because Gottman is used for couples and so forth. The list goes on. So just knowing which modality will work best with which clientele type. So if you're working with a couple, you're going to use couples-based modalities. If you're working with an individual, you're going to use individual-based modalities. If you're working with family, you're going to use family group modalities. And if you're working with a group, you're going to use group therapy modalities. So subsection C is align intervention with client population, veterans, minorities, disenfranchised, or disabled individuals. So what that means is if you're working with veterans, the intervention may include rehabilitation and trauma counseling. If you're working with minorities, it may include multicultural counseling, spiritual-based counseling, and so forth. So just what type of services do these subsections of populations need, right? Subsection D, implement individual counseling in relation to a plan of treatment. So if the treatment plan is around impulsivity and difficulty making decisions, a clinician may implement or integrate solution-focused therapy or CBT therapy to support the client in reducing the symptoms. So again, if you're working with an individual, what are they struggling with and which modality works best for the symptoms or the diagnosis that they present with? Establishing therapeutic alliance. So therapeutic alliance is basically establishing a safe, collaborative, and healthy therapeutic relationship. It usually includes you as a clinician supporting your client in self-advocacy and supporting and empowering them to work towards the goals that they set forth in counseling. So if you've established a strong therapeutic alliance, you are going to be able to challenge your client to grow in areas in which they are or could be struggling in, or you're going to empower your client to speak up for themselves or set boundaries or whatever. And also you are going to teach them how to talk about issues or concerns that they're having with their experience in the care that you may be providing them. Like, what do you want more of? What do you need more of? Therapeutic alliance is healthy relationship. That's really what you want to think about, and how that healthy relationship is going to help you better serve your client. Apply theory-based counseling interventions. So this would be interventions that have been research-based in developing the theory, right? So REBT is an intervention in which there's a much research on, and astrology-based interventions are not necessarily research-based theories. Now, there may be new research coming out about it, but you are responsible for knowing all of the widely used research-based counseling interventions and how to actually apply them. So CBT, REBT, Rogerian, Adlerian, person-centered, Gestalt, existential, knowing what they are and what they do and how they support you in, or how you apply it in services is what you're going to need to know for section F or subsection F. Address addiction issues. So some clients may come in with co-occurring disorders. So it's going to be important for you to implement some possibly sort of addictions counseling or addictions related concerns. So this may be your teens or your young adults, or even just adults that are struggling with marijuana, alcohol use, or other prescribed medication abuse, right? And so some clients may not identify as having a substance use issue when they come in. They may tell you, they may not even describe the fact that they use until several sessions in. You may learn that your client is excessively using some things. And not only are they excessively using things, they are it is impairing their relationships. It's impairing their ability to do their jobs effectively. It's impairing their marriage, their financial choices, their impulsivity. That's how you address addiction issues. So just knowing like how to identify them, but also how do you actually address those issues in therapy? Addressing cultural considerations. So when working with clients, all clients have cultural considerations to consider. From Black clients struggling with how society views them, to white people or Caucasian individuals who struggle with feeling guilty about their privilege, to all other cultures in between that you will work with. Race could be a struggle for them. How they present within their small cultural unit may be important to them. Understanding how they show up in the world, understanding their cultural perspective, and also understanding how their culture impacts how they experience or how they are able to manage their symptoms. Again, just being Black is not necessarily struggling with societal views. Being Black is also not being Black enough. Being Black is also colorism. It's also being too light-skinned, too dark-skinned. Being Black is also being too skinny, too thin, too big, there's a lot of cultural integrations in how, Black people show up in therapy and how they present. And so I'm just using it as an example just because those are lived experiences, not necessarily directly by myself, but things that I know to be true within our community. And so just understanding, okay, even strong Black woman complex, are your clients who are coming in, who are telling you everything is okay, are they doing it because their community has told them you're supposed to be a strong Black woman? Like, are you really able to identify and highlight those things? Again, not necessarily to make it a race thing specific for the exam. There are going to be some cultural considerations that you're going to have to either have some prior knowledge to or be privy to in order for you to answer certain questions if a race-based question comes up on your exam, because it is possible you may get a question about Asian-based populations and rules regarding marriage or rules regarding who's the head of household. You may see, again, cultural questions about clients struggling with their guilt about being Caucasian, or clients, just the list goes on and on. So I'm not going to go down that rabbit hole like I was about to. All right, address family composition and cultural considerations. So understanding the culture of the family unit, right? Again, my experience in my Black household and my Black family is not going to be the same as my counterparts in their Black household and their Black experience, right? So just understanding Also, birth order, understanding family roles is going to be important. Who's the scapegoat? Who's the whoever? What role do they serve? And so to be more specific, family order and family culture is equally important, which is why discussing family history in the intake and throughout the therapeutic experience is important. Some families believe that incest is normal and is a part of their family dynamic and culture. Some families have family members who heavily rely on them and mentally beat them up, leading them to cause or seek services and so forth. So again, these are your strong family members who everybody comes to and relies on and pulls on and takes and takes and takes. And if they do decide to set a boundary, they feel bad about it. They feel guilty because that is a cultural norm or that is a family composition. All right, so subsection J, evaluate and explain systemic patterns of interaction. So when working with clients, it's important to identify patterns of interaction with interpersonal, employment, social, and educational and other systems that they operate within. So the clinician should evaluate for maladaptive patterns or maladaptive interactions that they consistently experience with other people. So you're going to have clients that probably come in, or there may be questions about a client who is struggling with how they manage interpersonal relationships. They may come in and say, I'm a bad person. And you may be trying to, go down a trickle down and try to figure out, well, why are you a bad person? Well, it's specific to understand, well, it's your job to help them realize what are the patterns that they are expressing or experiencing or engaging in that's causing society or the community or their friends, whoever, to determine that they are a bad person or interactions that they feel are bad to other people. Family member interactions. So this is where, again, the clinician will explore birth order, family roles, family systems, and how the client interacts within the family unit in regard to those specific interaction types. Exploring religious and spiritual values. So some clients would like to discuss religion and its impact on their values, thoughts, emotions, and behaviors. As clinicians, we have to be open to having dialogue around religious or spiritual beliefs and how it impacts others and their quality of life. Regardless of what your beliefs are, you are still required to support clients who operate within a different belief system as you, but also you have to be comfortable, unbiased, and safe in your approach in exploring religious and spiritual values. Also, in the same sentence of religious and spiritual values, your job is to make sure that you explore them. How has religion or spiritual values impacted your overall experience in life, quality of life? All right, subsection M, guide clients in the development of skills or strategies for dealing with their problems. So what happens in this subsection, or what you may see on the exam, or how to better understand this particular subsection, is skills development and how to include a variation of coping skills for helping them in coping with their issues. So this, again, could include coping skills, education-related skills, time management skills, interpersonal relationship skills, advocacy skills, behavioral skills, sensory skills, and the skills list can go on and on. So just being mindful about guiding clients to the correct type of skill that would best help support them in their journey. All right, section N, help clients develop support systems. So some clients struggle with not having support systems or struggling with the utilization of their coping skills. So these clients may lack or hold maladaptive beliefs or abilities to utilize coping skills or have barriers preventing them from utilizing them. So helping clients develop support systems, all that essentially means is helping your client identify what they need and relying on the people, the systems, the educational, medical, healthcare, any type of system, helping them identify how they can better use it to better support them in their journey. Subsection O, help facilitate client motivation to make the changes that they desire. The therapist should support in the increase of motivation for clients, and it could be in all areas of life, such as educational, social, health-related, or any other type of motivation that they need to help them overcome experiences with exhaustion, fatigue, and their inability to actually increase their motivation. So probably we'll see something around motivational interviewing right here. But for the sake of your exam, just understanding how do you facilitate motivation in your clients to effectively implement the treatment plans, effectively maintain their counseling sessions, effectively help them come up with tools they can use, and effectively help them understand that they need to implement the coping skills that they came up with. And if they're unable to implement them, motivating them to create new goals that they can possibly better implement in their life to help reduce the issues that you guys are working on. All right, so improve interactional patterns. So this is where the clinician supports the client in developing interactional related skills to support and improving patterns such as healthy communication, self-advocacy in areas of interpersonal interactions, and responding to distress and dynamics. The next is going to be providing crisis intervention. This will look at the appropriateness of crisis interventions for clients who show up or call in a crisis. This would be supporting a client who has experiences or has self-harmed, who are in immediate danger or who have a plan or intent, clients who are having severe reactions to a stressor or a trigger, a client experiencing panic attacks within the therapeutic session, mid-session, and you got to help stabilize them. And then thinking about what are the different types of crises, and how you may help the client in the best modality for supporting that client. So identifying crisis and being able to provide interventions or treatment in the midst of a crisis. Subsection R is to educate the client about transference and defense mechanisms, okay? So support the client in identifying the misplacement of feelings or desires onto others. This can be in situations in which a client may see characteristics of their mom in you, the clinician, or in someone else in their life. They may attribute motherly feelings to you or the other person in their life. These feelings could be good or bad. Educating the client different types of defense mechanisms, including repression, denial, projection, and displacement, sublimation, regression, humor, rationalization, fantasy, projection, anticipation, and reaction formation, and so forth. Like there's an entire list of defense mechanisms based on the modality, right? So just being mindful of even possible cognitive distortions that fall under this as well. Facilitating trust and safety. So your job as a clinician is to facilitate trust and safety. So your job, based on the Code of Ethics, the ACA Code of Ethics, the NBCC Code of Ethics, and probably your state board of Code of Ethics, state licensing board Code of Ethics, your role is duty to protect. And this is done through the development and facilitation of trust and safety. This is done by knowing your limitations, knowing what confidentiality looks like, and how it all overall impacts your client. Build communication skills, which is subsection T. So building communication skills can be done through the use of psychoeducation around assertive versus passive communication, verbal and nonverbal communication, how to ask for clarification, monitoring tone of voice, maintaining or continuing a conversation, how to handle or have or hold healthy conflict, and how to vocalize boundaries with others. So think helping your client identify areas of growth in a communication space and how not having certain skills impacts their overall level of functioning. Develop conflict resolution strategies. So the key to supporting a client in developing conflict resolution skills is through discussing ways to manage emotions in difficult situations, how to de-escalate, the use of fair fighting rules, use of assertiveness, facilitation of conflict, problem-solving techniques, mediation, listening skills, and empathy. All of these things are important to help your client in conflict resolution skills and strategies that they can implement outside of therapy. Developing safety plans. In graduate school or during your practicum placements, there should have been at least 1 or 2 instances in which a safety plan had to be implemented. And I say that should lightly, right? Hopefully you didn't have to do one, but there's a possibility you had to do one. And you probably had one client that slipped through the cracks, even if the facility that you did practicum or internship in doesn't deal with suicidal ideations or homicidal ideations or self-harming behaviors. Something, somehow, some way, it manifested in therapy. So safety plans should include a list of coping skills they can try, a list of triggers, a list of people they can communicate with, a list of 2 to 3 resources or helplines in the area, and alternatives to engaging in risky behaviors. So when you think safety plan, think, what are all the things I need to put in place to best support this client? All right, and the next is facilitating systemic change. Facilitating systemic change is where the clinician is advocating for benefits and services that would best benefit their client. This could be in various settings in which the clinician would engage in facilitating systemic change, including educational systems, healthcare systems, insurance systems, and so forth. So knowing how to facilitate or guide change and advocacy for your clients is going to be what this section talks about. It also could include you helping your client facilitate familial systemic changes, work system changes as well. So how do these systems impact your client, and what are some ways you can help your client in facilitating change so that it can stop impacting or so they can alleviate the stress of your client? So real big section. And again, if you had a good practicum site and your supervisor did do some coaching, they did do some mentoring, and they actually sat down with you and supported you, this section should be easy and second nature for you. Now, again, you are going to need to know some key vocabulary terms and what they look like, but you can still be successful on this section just by your experiences in the field.